Good evening, everybody, and welcome to this evening seminar on knee pain. My name is Ed Butler. I'm a physiotherapist by background and currently work for AposTherapy. So we have some objectives to achieve this evening. We're going to talk a little bit about the knee itself and moving into a little bit more depth into the symptoms and possible causes of knee pain. Importantly, what can actually happen if you don't address your knee pain. And then there's going to be opportunity to overview current treatments that are available. So I'm just going to give you a little briefing here on how to use the webinar. So at the moment, you're all on what we consider mute. So I'm the only person that can be heard. You are able to type in questions at any point on the window on the right-hand side. And what we'll do, we'll gather those questions together. They're all anonymous, and we'll send out the answers at a later date via email. But there will be actually opportunity to ask questions as we go through. And if there's any particular questions that are of interest to the group, I shall answer them as we go. I'm also going to be asking a few more questions, and we call them webinar polls. So the idea is that you can indicate on the right-hand side as to what corresponds to your situation. So this will all become very clear in just one moment. So we're going to start actually with a poll to begin with. So, how would you describe your knee pain? You have now a minute or so just to indicate severity level to me. Okay, that's a lot of people nearly finished there. So, okay, so interesting results that have come in. Majority of people have indicated that they suffer from severe knee pain, and also similar numbers with regard to moderate knee pain. So now I think it's really appropriate if we move on to looking at the knee itself, and then we can work out exactly what may be causing this knee pain. So if you look at the video on the screen, the knee is actually a very, very complex joint. We often just talk about the bone and the cartilage, but as you can see through the illustration here, there are many other structures involved. There's tendons, ligaments, and within the knee itself, there's what we call meniscus. Now, meniscus forms part of the cartilage, but is often one of the main contributing factors to conditions such as arthritis. Now, as a physiotherapist, I want to point out to you the importance and the role of muscles and how they control the joint. So all of our movements are controlled by the brain, switching on and off the muscles at the right times to give us controlled and stable movements. So what type of symptoms do you experience? So it's another poll here, so you have another 30 seconds or so to indicate to me. Okay, so the results are just about in there. Unsurprisingly, the vast majority are indicating knee pain being the main problem. And we're going to discuss some of the other symptoms that you may be experiencing now. So when we're talking about pain, this can range really from what we consider a dull ache to something possibly sharp and really causing agony. It's important to mention that pain varies from individual to individual. Some of us consider ourselves to have higher pain thresholds. Other people know that they can be quite sensitive to pain. The important thing is that whenever you're dealing with a healthcare professional like myself, you just have to be honest and truthful about how severe these pain levels are, and importantly, what activities or movements can cause them. Stiffness. Now, this is also one of the very high indicators on the poll. Stiffness generally will be felt after long periods of rest or sitting or when getting up out of bed in the morning. A number of my patients will also say that their knee feels stiff whilst they're actually doing movements. So particularly ones which involve a lot of bending, such as getting something out from a low cupboard or maybe going up and down the stairs. Swelling. Now, swelling is quite an interesting one because some people experience swelling which may be related to activity, and they may describe it as that their knee blows up and becomes red as well as swollen. Other people may suffer from swelling that seems to be there most or all of the time. The important thing about swelling is it's your body's way of showing you that actually damage has occurred, or that there is underlying damage present. So I think it's very important to note that if you do activities that cause an immediate response to swelling, it may be appropriate to reconsider that activity. Noises or crepitus. Now, this is the strange crunching or clicking that we can sometimes hear and that we often feel as well when we move. It very often comes from the patella, which is your kneecap. Important things to note: if it's painful, it's more of a concern, but it can be considered quite normal to have crunches and clicks in lots of our joints in the body. And if it's not painful, it's usually nothing really to be too concerned about. Instability. So this is the feeling that your knee may actually give way on you. There is a safety consideration here because this is often felt when you're coming downstairs. So I certainly recommend to all of my patients that if they feel this, they must make sure they're holding on to a banister. And what gives us this instability feeling is the muscles themselves. So when they're behaving badly and not stabilizing the joint, they have these split seconds where they switch off for a little bit too long, which immediately gives you that sensation that your knee may give way. And finally, locking. Now, locking, or what I consider true locking, where your knee will be stuck and fixed in one position and may be very uncomfortable to click out of position, that actually may require immediate medical attention, because that may be a structure within the knee that is mechanically blocking its movement. So what really could be the underlying causes of knee pain? So it could be the joint changes itself. So what I mean by that is the coating of your bones within your knee. They're covered in what we call cartilage, and this may also be, on top of that, have meniscus involvement. Now, osteoarthritis describes the most common form of joint change, which is often termed as wear and tear, and it actually affects millions of people in the country alone, and it's a big burden on the NHS, unfortunately, when it comes to surgery that has to be performed. So surgery for osteoarthritis would be considered the last option. So injuries, I would usually bracket injuries as something that affects the soft tissues. So if you're watching the football that's on this evening, there may be a ligament strain occurring in a particularly harsh challenge. And the good thing, if there is a good thing about injury, is that it can often recover through non-invasive and conservative treatment modalities. Tendon irritation. So this is a little bit more tricky. So our tendons are the structures that join the muscles to the bone. So they're very, very important in providing movement. And because of that, it means that abnormal movement puts excessive stresses and loads on the tendon. So the most common tendon in the knee to be affected is the patellar tendon, which is the one that joins your kneecap to your shin bone. And that can be quite a common area of irritation, particularly with repetitive tasks. So the patella itself, so due to this anatomy, it's often a combination of joint changes and soft tissue changes. So behind your kneecap, you do have an area of cartilage. So this can be prone to osteoarthritic changes. But as I've just mentioned with tendon irritations, being quite a complex part of the knee, there can be a number of structures that are affecting it and therefore causing painful symptoms around that area. So have you received a diagnosis from a GP or another healthcare professional? Okay, I'll just close the poll there, so it looks like everyone's answered very, very quickly, which is great. And I'm pleased to see that the majority of you have had a diagnosis. I think first things first, it's important to inform your GP of any symptoms or problems that you're experiencing, and we'll come on to the reasons why in a little bit. But the majority of you have a diagnosis. So what if you don't inform your GP, or what if you leave your painful symptoms to continue? Well, unfortunately, they're likely to increase. And your functional levels, as your pain levels increase, your functional levels will slowly reduce. We call this the envelope of function, and it can actually catch people out sometimes and have a big impact on quality of life. I see a lot of patients who have maybe just retired or are about to retire. And what they say, the common story that I find is that they intended to do lots of gardening, or they intended to play a lot of golf once they retired. However, when it came to retirement, when they tried to be more active, they realized that the niggling knee pain in the background had suddenly become quite a big problem for them. Now, because of that, what often happens is that when symptoms are left untreated, the structural problem that's causing them can itself worsen. So it means that when you do try and address your symptoms at a later date, the treatments available to you may be less effective and can be more of a challenge for both yourself and the healthcare professional who is administering them. So what treatments have you already tried or are currently undergoing? So there's a few options here. So I'm going to give everyone a little bit longer to get the votes in the poll. And I can already see that there's quite a spread. Okay, so we're just going to close there. We have plenty of results in. Okay, so let's take these options one by one then, so we can discuss what people have tried. So the first thing, and the majority of people have tried pain medication. I think it's fair to say this is usually the first option for people, and maybe enough in many cases. We all have the reservations about continual medications because of the possible side effects that may be there. So this is where it's very important to discuss thoroughly with your GP. Injections. Now this would be considered an invasive procedure. There's two main types of injection that we come across. The first one is a steroid injection. Steroids can be very, very effective. They can provide usually up to about 3 months worth of relief from painful symptoms, which is crucial for those that need to start a rehabilitation program but can't because of the pain they're experiencing. There are some downsides to steroids, of course. People are only able to actually usually have maybe 3 injections, where any more, it's believed that they actually can cause and speed up the degeneration that may be present. The second type of injection is called hyaluronic acid. Now, just to give you an idea, some of the names that are used on the market are Ostinol. Ostinol is probably the most common injection. Now, these have less side effects, but also slightly less efficacy, so they're not always quite as successful. The plus side is they can be administered more than 3 times, and often people would have up to 3 over the course of a year and then move on to another year as well. Physiotherapy. Well, being a physiotherapist, I'm obviously a massive advocate for it. If you think back to the previous slide where I showed you the anatomy of the knee, you would have seen the vast amount of muscles that are involved in the movement. And really, this is where exercise comes into its own. You have to maintain these muscles to provide both stability, but also to carry out everyday functional tasks. Osteopathy and the use of a chiropractor. So can again be very, very beneficial, particularly exercise-based treatments here as well, but also if there's particular acute swelling or a limitation in range of motion, this can be a useful option to try. Supplements and nutrition. Now, I get asked about this quite a lot, and it's a very, very difficult one to give a clear answer to. Now, I can only really give my opinion here, and I'm of the side that says you must try supplements, and many people I treat will actually get some benefits and feel some benefits from supplements. I've also come across, with regard to nutrition, some quite interesting stories over the years. One gentleman once that cut potatoes out of his diet, and his knee pain reduced quite considerably. Also, alcohol with certain acids that are of the ingredients can also aggravate knee symptoms. Just to give you two examples. Podiatry and orthotics. Now, this can be a very effective way of treating your knee pain. What podiatry and orthotics do, they change the mechanics and the forces that can pass through the body. Like the majority of treatments available, there are limitations in the fact that you'd have to wear the orthotics in everyday footwear all the time. But again, I do have plenty of patients that constantly and continually wear their orthotics due to the benefits that they feel. Finally, surgery. Now, I've obviously put this at the bottom of the list here for a good reason. Surgery has to be really the last option for people. So I work with a number of surgeons at the moment, and it's if I'm ever struggling with a patient and we're looking for the next option, that's when I would refer on to the orthopedic consultant for their opinion. There are a number of surgeries available, ranging from what's considered less invasive, such as an arthroscopy or keyhole surgery, all the way through to something much more invasive, such as a knee replacement. The knee replacement shouldn't be taken lightly. The consultants I work with generally tell their patients it's up to an 18-month recovery period until you feel back to yourself following a knee replacement. Has anyone got any questions? So this is going to be an opportunity for you to type in some questions, and then I'm going to select a couple just to read out and share an answer with the group. Okay, so someone here's just asked me a very interesting question about the assessment process. So I think a thorough assessment is crucial for when dealing with a knee complaint. Now, obviously, depending on the situation you're in, people are limited with timings with regard to assessment, and it may range from a simple assessment in an acute setting, such as range of motion and some palpation, to something far more substantial, and with using the use of other tools such as gait analysis, which is walking analysis, or even through to X-rays and MRI scans. I have another good question that's just come in. So it's a gentleman that's talking about the accumulation of fluid that's felt. Okay, so there's a couple of questions in one here. So it's about the accumulation of fluid. So that would be the swelling within the knee, and also about two particular medications that are used. It's not appropriate for me to comment on medications in this format, but what I can say is from personal experience that icing your knee in order to reduce swelling and inflammation is, in my opinion, one of the safest, obviously, but also one of the most effective ways of treating yourself. So I have patients that use anything from a bag of peas all the way through to a specific ice pack. And the general advice is, after activity, if the swellings come up, is you put the ice onto the joint for about 10 minutes. Be careful not to put it directly onto your skin in case of causing a burn. So usually a tea towel is appropriate. Put it on for 10 minutes. Can be uncomfortable to begin with. No one likes feeling that cold. But if you repeat that a number of times maybe every 2 to 3 hours until the swelling reduces, that can be very, very effective. Okay, this is an interesting question. When you have been advised that partial knee replacement will defer the need for a total knee replacement, is there a mode of therapy in between? Okay, a very, very good, interesting question. So for those of you that don't know, a partial knee replacement is when they only replace one side of your knee. Now, I know that sounds funny, and I wish you could see me now because I'd use hand gestures to explain it. But if we imagine maybe just the inside part of your knee, that's the most common area to be replaced. Now, the thought process behind it is it's often used in maybe a younger individual, and it's a way of prolonging the need before a total knee replacement. So, as with anything, I advise people you have to make sure that prior to surgery, your muscles are in the best shape they can possibly be in. Because after surgery, those muscles will, A, behaving badly, you'll have other swelling and range of motion to contend with as well. So the better you can keep your muscles before, after surgery, the better and the quicker the rehabilitation will be. Okay, we're going to move on now because I'm going to discuss a few more options for you. So as you're well aware, I work for a company called AposTherapy. So I'm just going to briefly introduce AposTherapy to you, and hopefully it would make some sense following what we've discussed previously. So there's three main components to the treatment itself. So the first one is that we're all specially trained physiotherapists. We're in a very fortunate position where we have up to an hour and a half to evaluate and assess our patients. And part of our assessment process is that we use as many what we call outcome measures as possible. So this is questionnaires regarding pain and function and even quality of life, but also computerized walking analysis. And what this enables us to do is take those measurements at each and every follow-up so we can adapt and monitor according to the patient's needs. The second component is the unique biomechanical device. Now you'll see on the left-hand side of the page at the moment that there's two what are effectively rounded pods beneath the sole of the unit. Now these can be moved and positioned according to the individual and the symptoms that they feel. By moving these pods, we're actually able to manipulate the forces that go through the body. What does this mean for the patient? It means that by manipulating the forces, we can effectively offload damaged areas, which reduces painful symptoms immediately. Now, the second part and the second component is the fact that they are slightly convex. Now, some of you may have tried physiotherapy, as indicated before. A common way of making your muscles work and switching your muscles on correctly is to basically instill a level of controllable instability. Okay, so your body is forced to balance and work its muscles effectively. I'm just going to show you a short video now of a lady that turned up to our clinic having suffered a number of years of knee pain. And you can see on the video on the left-hand side that, for want of a better phrase, that she was limping. Okay, so she had gait deviations present. And you can see even up into her neck and her shoulder region, she was very, very tight because the pain was really affecting her as she was walking. Now, this obviously carries over into normal life as well, in that everyday tasks become difficult and challenging for her. On the right-hand side, if we play the video again for you, you'll see that the very first time she wears the AposTherapy device, and it's been specifically set up for her needs, because of the pain reduction and because of the muscle stimulation, she's suddenly able to walk much more normally again. So she's walking quicker, she's relaxing, and she's also remarking that her painful symptoms have reduced considerably. So now she has the device to take home. She's set up with a personalized treatment program, and she integrates wearing the device into her daily routine. For example, in her case, she was a busy working mum. So she would come home in the evening, pop the AposTherapy device on, and just do the dinner, do the household chores, sit down and eat, do the washing up, everything we all have to do in the evening. but she was getting the pain relief as she was wearing them, but she was also importantly getting what we call the carryover effect, i.e. her body was learning how to work the muscles in this correct pattern again, so that when she came back to us at subsequent follow-ups and later appointments, as you can see they're spread out at regular intervals, that actually her body had learnt how to work normally again. So if I play this video, it compares her barefoot walking when she started treatment to her barefoot walking after 5 months of treatment. And you can see she appears like a different person. So she's walking much quicker, she looks more comfortable and relaxed. Importantly, this works alongside her pain that she reports, in that it's reduced considerably with far less painkillers, and she's able to carry on with her normal activities of life again, which for her kids is obviously very important. So do any of you have any questions about AposTherapy specifically? Okay, this is an interesting question. I've got a couple here that I'm gonna discuss. So the first one is actually, how is AposTherapy different from orthotics? Now, the crucial thing to consider here is, if you remember earlier when I was discussing orthotics, you had to wear the orthotics all the time in your normal footwear. Now, AposTherapy takes it almost to the next generation, which is that because of the muscular stimulation and because of the repetitive functional exposure to the more desired movement patterns, your body learns how to work the muscles with reduced pain in your normal footwear. Okay, so that comes about by regular use of the system. Daily use is recommended for a short period in order to enable your body to learn how to work effectively. This is also another good question. Will AposTherapy work when one knee and one hip have already been replaced and the opposite side has been advised for a partial replacement? Okay, I do often see patients in clinic who have already had replacement to one or possibly more joints. The crucial thing to consider is it always comes back to the soft tissues. The surgeon's done a fantastic job at replacing the hard structures, so replacing the joint. What the surgeon hasn't addressed is all those soft tissue, those muscular compensations that were also still occurring. Okay, so what we do with AposTherapy, we're able to train and retrain these muscles to start working more effectively again, which can prolong the life of the replacement, but also it means we're able to focus on the other joints that are effectively having to take up the slack. So we can redress the balance of loads and redress the muscle activity throughout what we call the kinematic chain. So as I say, very commonly seen in clinic. Okay, one more for me. So I've been diagnosed with rheumatoid arthritis. Do you think AposTherapy would help me? So for those of you that don't know, rheumatoid arthritis is more of an inflammatory process. It often affects the smaller joints, such as your fingers and in your hands, but can affect people in their more weight-bearing joints, knees and hips. Now, for this individual, I would recommend an assessment. There is a chance that it may not be suitable for you. If people present purely with rheumatoid arthritis, AposTherapy is not always the best option for them. However, of the patients we do see with rheumatoid arthritis, they often will have underlying osteoarthritis as well. So that osteoarthritis is what's considered the more wear and tear arthritis. Okay, so this is another very interesting question. Would it help anybody diagnosed with chronic regional pain syndrome? Okay, so again, one we have to exercise more caution with. So chronic regional pain is slightly more complex than a musculoskeletal disorder. I have had people in the past where actually setting different objectives of treatment is more effective. So possibly if the person with the regional pain syndrome is limited in their function, this is still often to do with how the muscles are working and the body's response to pain. So although AposTherapy may not be able to affect the pain specifically, what we often find is people get very effective results in improving their functional ability, i.e. they're able to do more before needing to rest or before pain becomes too much. Okay, I'm going to take a couple more questions that have just come in. So can AposTherapy help with lower back pain? There's a widely recognized phenomenon in musculoskeletal medicine, and we call it knee back syndrome. Okay, so the vast majority, about 60% of people that have a knee problem also present with lower back pain. And this is all because of what I've said earlier, which is the kinematic chain, which means if you go back to the nursery rhyme you're taught as a child, you know, knee bone connected to the, I can't remember the nursery rhyme. But the point is that all the joints in the lower limb are all related. So one movement abnormality in one area has a direct effect on another area. The lower back, due to our sedentary lifestyles that we lead, is often an area for dysfunction, and AposTherapy can be used in the same way in order to develop the stability around the small joints in your lower spine, and therefore reducing the painful symptoms. Okay. The hospital went to cut a wedge out of my shin. Will AposTherapy work instead? Okay, so a wedge out of my shin. There's a technical term for that, is an osteotomy. It's quite a drastic operation in order to change the actual alignment of the lower limb. Now, I work with a very well-renowned surgeon who does perform this technique, so it'd probably be unwise of me to comment too much here without actually having seen you. What I can say is a bit like a partial knee replacement. It is a surgery that's often used to prolong the life of the knee, and before a knee replacement is recommended. In my experience with AposTherapy, as long as the deformity, if you like, is not too great, then absolutely. Okay, so we get a very considerably clear and good results with people who have what we call a varus knee alignment, which means it's like a bowed leg shape. AposTherapy is very effective at treating painful symptoms with this. Okay, I think that's probably, if anyone's got any questions they want to type in very, very quickly, I think that's probably enough. There's some great questions there. There's some really quite technical ones. Put me on the spot for a second, but no, really, really interesting stuff, and I hope you found it informative. Okay, so I am open, obviously, to further questions should they arise. And if you'd like to discuss your individual situation with me or a colleague, then I will leave these contact details on the screen. And we will also send you the contact details via email. So my last question, and it's an important one for me, is have you found this webinar informative and interesting? Okay, a few more seconds there. Everyone was very quick in replying to that. And I'm pleased to say that the vast majority have indicated very or extremely useful. So I'm glad you've enjoyed it this evening. And as I say, do get in touch if you feel that we could help you further. Good evening.